The lymph drainage is, in a nutshell, it helps to remove pathogens and toxic materials from your body. So when your lymph system is not doing well, it just means that the body's ability to remove those things are not that good. So obviously, when it doesn't do its job properly, it affects your immune system and generally your health. My name is Fynn, and I do lymph drainage, and I've been doing it for about 15 to 16 years. The way I do my lymph drainage, I need to assess how efficient the system is, and secondly, where are the issues? Where are your lymph nodes blocked? And then subsequently, once after a couple of treatments, I get to know the patient's body. Then I know exactly where this patient's usual problems are, and those will be the areas that I focus in. In the case of TSW, most of the time it will be in areas where they have the TSW breakout, and that usually is upper limbs as well as the lower limbs, and also the face, neck, also maybe the ears. Then depending on what I'm going to work on that day, the nodes that are in those areas will be my focus. So I make sure those nodes, so for example, if I'm going to work on your face and your neck, then I have to make sure that all the nodes that are connected in that section has to be cleared before I proceed on to doing the cap therapy. A lot of people, when they first consider doing this treatment with us, they always ask, how long does it take? How often they need to come back? This is a difficult question to really answer because it's different for every patient, because it really depends on your body's condition. If it's more serious, obviously it takes a longer time. The journey of healing is not a straight line. You have to be prepared that somewhere along the way you may have a setback, and that would delay the healing. It really depends on how serious your condition is, how well your body responds to the treatment, and whether there are any setbacks. But I would say from my experience so far, generally speaking, some patients, can get to a point where I would say almost their life is back to normal within about 3 to 4 months. But then I have to say there are cases where they have been coming to see me for almost a year, and still condition just goes back and forth. The setback usually is caused by infections. Now, the other thing about how long each session is. Basically, in the beginning, I will always recommend 90 minutes. Lymph drainage takes about half that time. Okay, but once I get your lymph up to I would say, acceptable efficiency level, then the lymph session would be cut back, and then the time spent on cap therapy would increase. But in total, it's usually about 90 minutes for the first few sessions. It's quite common for TSW patients to have skin issues in the neck, face, ears. It includes weeping, flaking, itchiness, and so doing some self DIY lymph drainage daily by yourself actually can help to improve the condition.